This is WFYI News Now. It's April 7th, and I'm Zach Bundy filling in for Abriana Herron. On today's show, one of the largest diabetes studies is under threat from the current administration's funding cuts. High school students who graduate with one of Indiana's new diplomas are guaranteed a spot at one of the state's 7 public universities. And House Republicans unveiled their property tax reform plan.
If you raise your rate, a taxpayer will pay more. If you cut your rate, the taxpayer will pay less. And right now in that system, in our current system, that is not true.
Those stories coming up, but first. The next installment of our segment called The Checkup, from Side Effects Public Media, where the health reporting team explores a single question sparked by a recent news story, or maybe by one of our listeners.
Republicans in Congress are looking for ways to shrink federal spending. Some proposed cuts, like reductions in Medicaid, are unpopular, but there is one proposal that has broad bipartisan support, and that is site-neutral payments. So what are site-neutral payments, and why are rural hospitals concerned about that proposal? That's the Checkup's question for today. I'm Lizzie McGreevy, Community Engagement Specialist at Side Effects Public Media. With me today is Melanie Evans, a producer with health policy news organization Trade-Offs.
Hi, Lizzie.
Hi, Melanie. So start off, what are site-neutral payments, and how can they save taxpayers so much money? I read that they could save taxpayers up to $150 billion over a decade.
Yeah, so the name site-neutral is really awful and awkward, but the idea behind it is actually pretty simple. Currently, Medicare pays more to clinics that are owned by hospitals than it pays to other clinics. These are, independent imaging centers or a clinic owned by a physician. So here's where site-neutral comes in. These higher payments to hospital-owned clinics add up to billions of dollars a year. Medicare could save a lot of money if it switched to just paying all hospitals the same, and that is site-neutral in a nutshell.
Okay, great. So we've talked about the dollars, but let's talk a little bit about patient experience. How could this policy impact patients' experience within the healthcare system?
Well, there are about 34 million Americans with traditional Medicare, and they pay 20% of their clinic bills. So at a clinic owned by a hospital, that bill is higher. They would spend less if Medicare switched to paying most clinics the same. And one analysis I read said Medicare cancer patients would save between $300 and $1,000 on chemotherapy under site-neutral. But there's another way this could save money. Economists said that if Medicare paid all clinics the same, maybe hospitals wouldn't buy up so many clinics. When hospitals buy up clinics, they get bigger and bigger, they start eliminating the competition, and then they have the power to raise prices for everybody, including privately insured workers and their employers.
Well, this proposal has bipartisan support, which is refreshing, but we wouldn't be having this conversation if there wasn't some pushback. Can you walk us through some of that pushback and those concerns?
Yes. So hospitals are opposed to site-neutral payments. They say they need the higher payments from Medicare to cover all of their higher costs. They have more regulation than other healthcare providers. They have a lot of expensive technology. They have really highly skilled workers who are highly paid. They're open around the clock. Rural hospitals, in particular, are saying they should be exempt from any site-neutral proposal. And that's because not only do they have all of this high overhead, but they are typically in sparsely populated areas, which means that they don't have as many patients to cover those costs. They're concerned that under site-neutral, they would get less money, and that would force them to close services or close their doors.
Melanie, that certainly throws a wrench into this proposal. Can Congress just make a sweeping exemption for rural hospitals then? What are some other options you're hearing?
So yes, they could exempt rural hospitals, but there are kind of two issues with that. One, Republicans are looking for a lot of savings for their tax cuts. And the second is that if you exempt rural hospitals, Medicare patients in rural areas are still paying more. So I spoke to a number of people who really don't like that idea. The other proposal is requiring site-neutral payments for all hospitals, including rural hospitals, but then giving really distressed facilities an extra subsidy. The real trick here is for Congress to decide which hospitals are truly distressed and need a subsidy and which might be able to get by without it.
Thank you for this information and for spending time with us today, Melanie. If you have any questions you're too shy to ask your doctor, want to know if you're hearing a medical myth or fact, or just general questions about healthcare, let us know. And until next time, stay safe.
That was The Checkup by SideEffects Public Media. SideEffects is a regional health reporting collaboration of NPR member stations across the Midwest, based here at WFYI. One of the largest diabetes studies is under threat from the current administration's funding cuts. SideEffects Public Media's Elizabeth Gabriel reports.
The Diabetes Prevention Program has sites in Midwest states, including Indiana and Illinois. The research aims to study Alzheimer's disease in patients with a family history of diabetes. More than $80 million in federal funds flow through Columbia University, but the Trump administration recently canceled grants to the university. Dr. David Nathan is a board chair for the project. He says the study has surveyed more than 1,000 patients for decades.
This population is worth its weight in gold, literally and figuratively.
Nathan says researchers can't recreate the study without millions of dollars. Elizabeth Gabriel, SideEffects Public Media.
High school students who graduate with one of Indiana's new diplomas are guaranteed a spot at one of the state's 7 public universities. From WFYI's Education Desk, Rachel Fredette has more.
Students who want to go to college would complete one of the new Honors Plus diplomas. That diploma requires a little more work inside and outside the classroom. Once completed, they can be automatically enrolled at a state university like Purdue and its multiple campuses. Mung Chang is the president of Purdue University. Last summer, Purdue was concerned about the new diploma requirements not meeting their admission standards. Chang says that's no longer the case.
We look forward to this new arrangement, and we understand that they will indeed have choices of all the campuses.
A 2023 law tasked the State Board of Education with adopting new diploma requirements. They approved them in December. High schools can phase in the new requirements starting next year. Purdue and other state university officials say they will be ready as soon as they do. I'm Rachel Fredette.
You can find more about the new diploma measures and automatic university enrollment on our website at WFYI.org. And for our final story today, House Republicans unveiled a property tax reform plan on Friday. They say it'll mean a majority of Indiana homeowners will pay less on their property tax bills in 2026 than 2025. The plan includes a new 7.5% property tax credit for homestead owners for a reduction of up to $200 on your final bill. House Ways and Means Chair Jeff Thompson says it also creates additional new credits for fixed-income seniors and disabled veterans.
And gives them the kind of relief that they really deserve.
Thompson says initially most local governments won't see big revenue losses, just not as much new revenue as they would have received without any changes to the system. The House GOP proposal also makes long-term changes to property taxes, phased in over several years. House Speaker Todd Houston says the goal is a more transparent system that's easier to understand.
If you raise your rate, a taxpayer will pay more. If you cut your rate, the taxpayer would pay less. And right now in that system, in our current system, that is not true.
Property taxes solely fund local governments and schools. That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, Abriana Herron, and me, Zach Bundy, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes, Kendall Antron produced our music, and I'm your host, Zach Bundy, sitting in for Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening, and we'll be back tomorrow.